Today I am going to discuss about the clinical parasitology. Let's see the introduction parasitology. What is the parasitology? Parasitology is the branch of science that concerned with the parasites and parasitism. Parasitism is a form of symbiosis in which one organism is called parasite benefits at the expansion of another organism, especially different species of called host. So association may also lead to the injury to the host. Some example parasitism is the association between the parasite, tapeworms, and the vertebrate host. Next, parasitology has different subdisciplines: medical parasitology, veterinary parasitology, structural parasitology, quantitative parasitology, parasites of ecology. Next, classification of parasite. Classification of parasite: umbilical parasitism, speculative parasitism, ectoparasitism, endoparasitism, mesoparasitism, epiparasitism, protoparasitism, social parasitism. Some examples of Plasmodium curvibots. Next, explain umbilicate parasites. Umbilicate parasite is the parasite that depends on host for its nourishment, reproduction, habitat and survival. It will not able to survey of any from the host. Define epiparasite. Epiparasites in the parasite that feeds off of another parasite. Some examples: flea living on top, feeding of it. Social parasitism that take advantage of interaction between members social organisms such and termites. It may be two types: interspecific social parasitism and intraspecific social parasitism. Some examples: intraspecific social parasitism, butterfly. Next, intraspecific social parasitism, parasite nurturing where some individual take milk from unrelated females, in which capit, capicinium, higher ranking females sometimes take milk from low ranking of females without any reciprocation. The high ranking females benefit at the expansion of the low ranking females. Protozoal and helmintic infection. Internal parasites of human being are divided two types: helmintics and worm. Protozoa. Helmintics are multicellular organisms that can be seen with the naked eye. There are two phyla: flatworms, roundworms. Phyla including some genera that mature of gastrointestinal tract and others that migrate through the tissue after injection of skin penetrated. Present the helmintic genera. The definitive and intermediate host, geographical distribution, and the parasitic of stage. Human body. Protozoa are microscopic single cell called organism. Among the many differences between helmintic and protozoans, the most important in the ability of protozoa, like bacteria, and multiply with the human body. The cost of overwhelming of infection, the mature mechanism promoting unrestricted growth. Vacation the most host humanoid responds either by antigenic of variation by cerebral inside the host cells of some example of plasmodium. Next, constant almost eliminating acute stage, other host completed the life cycles of multiply. As a result, expected of Can completed of life cycle humans increase the burden of infection helminth require repeated exogenous of reinfections. Helminth of infection, flatworms, categories of tapeworms, cystodes, termidotes, tapeworms composed heat so scores of bearing the structural host organs segments with behinds of craved the mature. Some tapeworms can reach length many yards. The longest tapeworms develop intestine where they rarely cause serious disease. It consists flukes of a small leaf-shaped organism whose size is not measured. Disease of survey. Nematodes. What is the nematodes? Nematodes is called a roundworms or non-segment bisexual organism. The species of infect human include industrial and dishes group. Human may also acquire certain non-human mammalians roundworms that either can be limited to the skin or can migrate tissues on causes of serious disease. The larva migrates of syndromes. Next, this Dable protozoa various of helminthics. This slide protozoa, helminthics, and cystodes, nematodes, nest disease, parasites. This slide life cycle of Trypanosa crazy. First stage, Tryptobug stage. Next, mammalian stage. Next, binary fixation of the cells infect the tissue. Next, intracellular penetrate of cells enter the bloodstream. Next, blood meal takes a bug. Next, mycete epimasticotes multiply in the mycete. Cycling of trypanosomes of in hand cat affected in the human being. Next, protozoa infections of the GI tract, disease, pathogens, signs of symptoms, transmissions, diagnostic test, antimicrobial drug. Detection of industrial protozoa in the clinical laboratory. Protozoa infections significantly contributed of the burden of the gastroindustrial lesions of worldwide. Some parasites. However, the accurate determinations incision of the infections in frequent testing stool protozoas para patients present with the gastroenterals ordinary physician and by the lake sensitive techniques by which identify or pathogenic protozoa stool specimens. Microscopic ova and parasite examination. Traditional methods stool parasite testing. Although the OP labor intensive and required high level skill, optimal interpretation, the test remained the concentration diagnostic test testing of industrial protozoa. Clinical diagnose nematodes symptoms. The common complete the vague abdominal pain. Abdominal pain in most several cases of patient may express weight loss. Some causes of symptoms is human being. Diagnose based Identification of egg. Micrometers 35 to 50 micrometers. The diagnosis. Treatment. uh, Good hygienic in best prevention of measure. Next, clinical diagnosis of cystoles. Stool samples of analyzers. Next, segments egg post of irregularity. The lab may need to the collector to 3 samples of periods time. Next, blood tested. Next, imaging of exams. Diagnose human dermatologic infections. Same procedure. Flood flukes, liver flakes, lung flakes. Diagnosed dermatodes infections commonly accomplished by identification egg of acres of urine. The egg most species are structurally distinct and the diagnosis can be made by standard light microscope. But expanding the drug choose dermatode infections precaution. Pathogenics of protozoa disease life cycle. Pathogenics of nematode disease of life cycle. Pathogenics of dermatode disease of life cycle. Cystode disease of life cycle. Prevent worms and parasites treatment. Prevent of parasitic disease treatment. Antibiotic. Ultraviolet radiations. Prevent pasteurization. Cooking food or vaccines. Wearing shoes. Avoid non-chlorinated waters.